Hello and salut, everybody. Welcome back to the channel, Chatting with Nicole. We are just chatting here. If you have not subscribed or you're new to the channel, I want you to do me a favor. Do that right now. Share this video and also check out the rest of the videos out there. I thank you very much for being here. I am very grateful for your support, as you know. But today, I want you to, the most important thing about today, this video is for you to share. It's important that you share this video. I am saying that because I was asked specifically by a mother. A friend of mine asked me to share this information, to post this information for all of the parents out there, because she's going through this with her child right now. Her child is sick. She's only 11 and a half months old. 11 and a half months old, and she's suffering from this disease. And she doesn't want any other parent to see their children going through what, her child is going through right now. And she doesn't want any other child, to be going through what her child is going through right now. So she wanted me to share this with you guys. So I asked that whether you know parents, whether your friends are parents or not, chances are, even though they're not parents, they know somebody who are parents. So it's important that you do me a favor. You do all of us a favor. You do your family and friends, your loved one a favor by sharing this information. I know it is on the news. She said it just came out this morning. Then it was on the news last night and it came out this morning. But not everybody is up to speed, up to date with information. You know that. So it's a lot of information that we miss. So I just want you to do your part. Save a child, from suffering. Save a child somewhere from suffering from this disease. So what I'm talking about is RSV, catching children, and it's worse on children, 0 to 2 years old, and they are suffering right now. Just want you to review the reporting and take the necessary steps. First thing is to share with everybody take the necessary steps and protect yourself. The recommendations are out there. It's involved washing our hands again, wearing a mask, protecting ourselves just like we did with COVID. So it's back on again. And we just have to do whatever we can to protect our children and protect ourselves. So watch the information. Do what you have to do. Do your part. I'll see you next time you see me. Stay safe and blessed. And let us keep each other, healthy by sharing the information with everybody. All right? And doing the right thing.
We're going to begin here tonight with a story that will be of particular concern to families with very young children. An alarming and unprecedented rise in cases of a potentially serious respiratory virus. Cases of the virus known as RSV now quickly rising in at least 32 states. RSV frequently infects children under the age of 2. But doctors say cases are appearing earlier in the season and more rapidly than usual. The virus usually presents mild symptoms, but according to the CDC, can cause more serious health problems. And now the surge of cases putting a strain on some hospitals, forced to take extreme measures to handle the influx of RSV patients. Gabe Gutierrez now with more from Connecticut, which has been especially impacted by the virus.
Inside Connecticut Children's Hospital in Hartford, doctors and nurses are sounding the alarm. They're seeing an unprecedented number of children with respiratory illnesses.
I have not seen this level of very quick increase in the number of cases with RSV, and certainly we have never seen it in this time period.
The hospital's in touch with FEMA and the National Guard about putting up a medical tent in its parking lot as it tries to keep up. Respiratory syncytial virus, or RSV, usually causes mild cold-like symptoms. There's no vaccine for it. Infants and older adults may develop severe infections from RSV, like pneumonia, because their lungs are weakened. Over the last month, 32 states have reported an increase in RSV cases. In San Diego, 50 patients have tested positive for RSV over the last few days at Rady Children's Hospital, where the chief medical officer says it's unheard of, 2 to 3 times what they've ever experienced. In Richmond, Virginia, Haley Mitchell's 13-month-old son was hospitalized.
That was mine and his first time being in a helicopter, and of course it was very scary. The EMTs in the back told me that there was a couple times they had to give him oxygen while we were flying.
Back in Connecticut at Yale New Haven Children's Hospital. Have you ever seen numbers like this before?
We have not seen numbers to this degree this early.
RSV cases in the emergency department have nearly doubled over the past week. Right now, every bed in this pediatric ICU is full, 90% of them with respiratory illnesses. Most kids get an RSV infection by age 2, but it can happen at any age. Health officials say the spread of respiratory viruses like RSV can be prevented through hand washing, staying home when sick, and wearing a mask if you have any symptoms. Typically, RSV peaks in February, but this season, all bets are off.
It's so unpredictable at this point. We're not really sure when it's going to peak and when it may come to an end.
Okay, this is obviously scary for families with small children. What's the thinking among doctors as to why they're seeing this early surge?
Lester, a lot of this may be due to the fact that young children had relatively little exposure to other kinds of viruses during the last several years of COVID, and now this is hitting their immune systems all at once.